you can't sanitize, and we always say this in the food industry, you can't sanitize and disinfect through dirt. You have to have a clean surface where that disinfect or that disinfectant solution or that sanitizer will come in contact with the virus. Difference between sanitize and disinfect. Sanitize, you reduce the number of organisms, while disinfect means you disinfect. There's no infection. You kill all the germs. But usually disinfectants have a higher concentration and a longer dwell time than you would with a typical sanitizer. We talked about this one. The effectiveness of disinfectant is influenced by the concentration of use and surface exposure time. If you look at a standard disinfectant wipe, and it might be Lysol or Clorox, but you can read the label, and it will tell you typically somewhere between 1 minute and 10 minutes. I checked one the other day, and it was 5 minutes to disinfect the virus. And that's good to know because I have to have that surface wet for that period of time. In most cases, if a disinfectant and it's used at disinfect concentrations on a food contact surface, you're going to have to rinse that, and you can't start a production line with that high level of disinfectant on the surface. Okay. Let's see, I think there's a couple of references here. Oh, there's one more. And disinfectants for routine use. Sodium hypochlorite is available in different concentrations when purchased, and this is a watch out. So typically, Clorox you buy off the shelf in the supermarket hopefully is around 6% or bleach that you buy, but it rapidly deteriorates in concentration. Sometimes in plants we get concentrated sodium hypochlorite that could be as high as 12%, 12.5%. So you have to know what concentration you have to get the right ppm level, and typically 1,000 parts per million for disinfection is sufficient. I've heard other studies that say 2,000 or 2,200, but typically for sanitization it's 200 parts per million, and typically for disinfection, from what I understand, it's 1,000 parts per million. Other infective ingredients, and the great thing about sodium hypochlorite is it is very fast acting, and usually within a minute you can get effectiveness, whereas with some of the others it takes a longer time period, up to 10 minutes. Alcohol, as Dr. Basavada mentioned, is another good tool to use, and 0.5% of hydrogen peroxide. Quaternary ammonium compounds are also good, but they're not as fast acting as the alcohol and hydrogen peroxide. Let's see, disinfection can take between 30 seconds to 10 minutes. Sanitizers are not effective on non-porous soil-free surfaces. And the EPA List N is another tool that's out there that can be used if you're looking for a sanitizer. And they have about every sanitizer and disinfectant out there that is disinfectant that's effective against COVID-2. As always, we always are cautious and want our employees to be safe, so they should know the rules to ensure that there's not any kind of misuse of the disinfectant, since it is a pesticide, either personally for personal risk and or for food risk. Okay, that sums up the 6 elements of the COVID-19 equation for safety for personnel and employees. And I'll pass it over to Samara.
Excellent. Thank you both very much for the great presentation. We're now ready to begin our Q&A session. If you haven't yet submitted a question, you can do so now by typing into the question box. Great, thank you everyone. We do have a lot of questions that have come in. The first question we have is there value in swabbing for the virus? Joe or Dr. Vasubada?
Yeah, I can take that one. So in any type of situation in a food plant, it's good to have data. And sometimes whether you have a cause in a situation like this in the pandemic, whether you swab for cause or not, meaning that you had a positive person, it's always good to understand the presence or absence of your enemy in a food plant. And so I think that swabbing does have a place, and it gives you a pretty good idea. And when I say swabbing, it's not like we would for Listeria or Salmonella. It would typically be for those high touch points that I referenced, something like your front door that may have a push play, have a knob handle. In the restroom, you may want to swab your restroom doors in your stalls. You may want to swab areas in your cafeteria that people commonly touch. And that front door is a good one because up to that point, what is on their hands really represents what they're coming into the plant with. And that could be a cross contamination point, the virus from one person to another. So I think swabbing would be a really good tool to help you understand the risk and be an early indicator of employees that may have the virus in your facility, because it will leave a trail. And so I think it does have a place in this scenario.
Great. Another one. What are hygienic design alerts with regard to cleaning for the virus?
I guess I can take that one as well. Hygienic design is important, I guess, for really two big reasons. First, the high touch points I talked about. It's really good to minimize high touch points, right? And people have taken off doors. They've redesigned push plates. They've put in automatic doors, just to minimize the number of touch points that people have to contact when they come into the plant or go to the workstations. That's one part of it, the number. The second part is if there are high touch points that are contaminated that you find out through your swabbing or you just know. And I mentioned the keyboard piece. A lot of people touch keyboards. Do you have a cover that you can put on the keyboard? Because that's a high touch point, and that could easily be a transfer point from one person to another. Kind of hard to do that with gloves. Sometimes people take off the gloves and enter data. So that would be kind of a hygienic design thing that says, okay, is this cleanable? And that's really what we need to do, is do a risk assessment on high touch points. Is this surface cleanable? And how do we get rid of a virus that's on the surface? So that's where I think it plays a pretty big role in the ease of managing the virus. The other part that I mentioned during the presentation is, minimizing traffic jams, if you will, where people back up to violate that 6-foot rule. So there's a lot of different things you can look at, and the guards from one employee to another. I put all of that stuff in the hygienic design category because it's ways to prevent that virus from spreading.
Great. Here's another one. Do FSMA preventive control regulations have any specific requirements for food processing facilities regarding COVID-19?
Maybe I can take that one. The FSMA preventive control regulation does not have any specific language regarding COVID-19. You realize it's a brand new virus. We didn't know anything about it till last December, but the FSMA preventive control has been implemented since last year, basically, or 2 years. So the language does not have anything specific to COVID-19. But remember, preventive control regulation requires all manufacturers to have a written food safety plan, which is based on the hazard analysis and risk-based preventive controls. Sanitation is part of the preventive controls. It could be maintained as a GMP as well. And if your risk-based hazard analysis says that COVID-19 or coronavirus might be a potential hazard, then you would address that in your food safety plan.
What is the number one priority when minimizing the risk of COVID in the food plant workplace? Number one priority.
I'll take a shot.
Don't have it.
I have. It's a hard question, but when I think about the big picture, and the big picture is, in order to produce food, we need people, right? And if people are sick, they shouldn't come into work. So to me, the number one priority is developing an education, training, culture improvement process whereby people who are with you 40 or 50 hours a week go home and spend the remainder of their week in also safe practices. And that's with their family, with their friends, that's riding to work. Because no matter what we try to do in our plants, we only protect the people while they're there. There's another half or 3/4 of their life that they spend somewhere else, doing something else. And they need to understand, for their own safety and for their own safety at the plant, the right way to conduct and the right behaviors to have to minimize the potential that they'll spread it or be caught in the spreading of the virus. So that's why I think it's the number one priority. It's not really around something that we would do specifically in the food plant. If everybody in the plant had the right practices and didn't catch it outside, they wouldn't bring it in. We didn't bring in the virus, right? It didn't come in with the ingredients. It comes in with the people. So if we have the right culture, I think that we have less of an issue just because it wouldn't be spread outside in the community and it also wouldn't be spread at work. I know that's a toil, but I think if we all got that better, and I think the whole safe distancing, the face mask in public, I think they're all great steps to prevent the spread of the disease, which is going to minimize the likelihood that it's coming in to the plants. But everybody has to buy in and be a part of that solution.
Great. At this time, we must wrap up our Q&A portion. For those questions that we did not get to today, they'll be addressed via email. If you have suggestions for other webinar topics you'd like us to address, please do let us know. As I mentioned earlier, this webinar has been recorded and you will receive an email in a few days with instructions on how to access it. It will also be available in a few days on demand on Food Quality and Safety's website in the Webinars tab under Resources at foodqualityandsafety.com. On behalf of Pernandu, Joe, and 3M, thank you for attending and have a great day.